Hi, it's Harry Brano. I'm going to talk to you today about issues around consenting for a stabilisation operation of your acromioclavicular joint. That's this little joint up here. I know you probably dislocated your acromioclavicular joint, and that's why you're considering an operation. And the vast majority of cases, the operation goes really well without any major problems. But like all operations, it doesn't come with a cast iron guarantee. There are things that can sometimes go wrong. So it's worthwhile listening to the video, thinking about all this, and then going back and talking to your surgeon again before you finally sign your consent. So the first thing to consider is that it may be a failure. It may not provide for you exactly what you want. What do I mean by that? Well, it might be that a year on from surgery you find you still have pain, or you still have a bit of a lump, or the shoulder's gone a bit stiff, or generally it doesn't feel quite as good as you had been hoping for. Now, in all those circumstances, there's often other things that could be considered again as further surgery to try and help, and they're all thankfully pretty uncommon, but it might not go quite as well as you would hope, and it's worth bearing that in mind before you finally commit to the surgery. The second thing that can happen is infection. We are introducing a bit of foreign material. Usually it's a strand of synthetic material that we use to hold the collarbone back down in place. And we hold it in place with a screw. So whenever we introduce foreign material into the body, that can be a source of infection. We will of course give you intravenous antibiotics as you go off to sleep before surgery, and when we do the operation we make sure we use very particular techniques to minimise the risk of infection, and we'll wash everything out very carefully before we close the wound. But despite all that, infection can happen, and if infection happens it can be an absolute nightmare. In the worst case scenario, it can mean having to unpick the whole operation, take everything out that you've had done, and leave you back where you were before you started, but having had 2 operations and a scar, and then a prolonged period of antibiotics. And infection can be very difficult to settle once it sets in. So let's not pretend it's not an important complication and one that's serious when it happens. It can almost always be treated, but if it happens, it can be a real pig and an absolute nightmare, and we'll all wish we'd never started on the operation in the first place. But thankfully, it's uncommon. In the vast majority of people, that doesn't happen at all. The next thing can happen is something quite odd. We can develop a fracture several months or maybe even a year or 2 after the operation. We loop this synthetic material around 2 bones. One is a bit of your shoulder blade called the coracoid, and one is the top of the collarbone or clavicle. And because the synthetic material is put under tension, we can watch on x-rays in some people that tense bit of foreign material is actually cheese wiring its way through bone, and occasionally the bone can get so thin that it eventually snaps. Now, we don't know the exact figures on this. We don't really know how often this happens. In my personal experience, I don't think I've ever seen this happen, but it is a recognised phenomenon and something that you might want to chat through with your surgeon if you have particular concerns about that. And then finally, the last thing to think about is stiffness. Whenever we operate on the shoulder, there is always the potential for it to become stiff. So we'll do an operation and put you in a sling for a while after the operation. That can provoke a response to the shoulder, which is to make it go very stiff. Now, thankfully, that's almost always just a temporary hiccup, and while it's really frustrating if your shoulder goes stiff and may well prolong your whole treatment process and require you to have lots of physiotherapy, eventually it does tend to settle itself down, wear itself away, and doesn't seem to have an impact on the good long-term outcome. If you're very unlucky and have very resistant stiffness, then there are procedures that can be considered to try and help, but that's almost never required. And finally is nerve injury. There are nerves all around the shoulder, and your surgeon will be very aware of where all the important nerves are, so it's highly, highly, highly unlikely that any serious permanent nerve injury will be incurred. But It is something that we will be asked to reflect upon and consent for, and if you are to have a serious nerve injury, it can be absolutely catastrophic. It can ruin your life and prevent you from doing the kind of work that you want to do. As far as I'm aware, I know it's never happened in my hands, and I can't remember any of my colleagues ever telling me that it's happened in theirs, but it's something that has to be borne in mind as a potential but rare complication with significant influence on your long-term bearing. But you've got to take everything in the round, and while this has been a rather scary long list of horrible things that can go wrong, for the vast majority of people, none of these problems are encountered, and they breeze through the operation without any serious problems and get a good long-term result. Overall, this is a very safe, reliable and effective operation. Thank you.